Good morning, everybody. It's Monday, the 23rd of August. Thank you for joining us for today's COVID update. And what I'd like to do today is sort of start at the top and look at what's happening across the United States, and then drill down to the state of Florida, Pinellas County, and then to Regency Oaks specifically. So let's dig right into the update. We're going to go directly to the TV screen. So here in the United States, COVID continues to rage. More than 83% now of all new cases are the Delta variant. In the United States, we're up to 37 million cases with 628,000 deaths. The same can be true in COVID, but there's one significant difference that I want to point out. The confirmed cases in Florida are 3,074,489, and we've had 42,252 deaths. The total tested, we've continued to see this number go up week over week. With this recent scare and the Delta variant, we are really seeing these numbers increase pretty significantly. Tested positive, we're 12.95. That's for the state. However, in Pinellas County, our positivity rate is still in excess of 19%. You can see the updated doses administered. We're up to just shy of 53%. And so you may recall that 2 weeks ago, we were just shy of 51%. So there's been almost a 2% increase in 10 days. And that's those are good numbers. If we were able to replicate that and see a 2% increase in each of the following 10 days, that's a 6% per month growth. And so maybe that's an encouraging sign. The data we're looking at here is broad. It's for the United States by region, and so we're looking at the southeast region. This includes Florida, Louisiana, Alabama, the Carolinas, and so it's the southeast quadrant of the United States. The top line in yellow is new cases, and you can see over there at July 1st, things were downward trend, not too bad, and then literally with the new cases, look how it brackets up until it gets to the point where it's almost vertical. And then the chart below is the deaths, number of deaths, and that has also gone just almost straight up, a vertical ascent. So this is an updated graph on hospitalization. It breaks it down into two types. Just overall beds, whether they're ICU beds or COVID bed, doesn't make any difference. That's the top graph, and then the ICU, intensive care unit beds, is the chart down below. It's broken down into non-COVID related cases, that's in the blue. In the brown are the COVID-19 cases. And so when we look at overall ICU beds, 2 weeks ago, 85% of the beds were occupied. Today it's 86%. When we go to the ICU beds, and that's where the sicker of patients are located, they're not in the general floors, but in the emergency room, ICU, the COVID floors, we've seen that 2 weeks ago we were at 91%, and today 93% of those beds are occupied either with ICU, regular emergency situations. But look at how that COVID growth has occurred. If you look at just the beds where there were 3.5 circles, the COVID beds in ICU are almost 5.5 brown circles. And so the people who are getting COVID are sicker and requiring more hospitalized services. Now, it is also true that the vast majority of those individuals that are hospitalized from COVID are unvaccinated. So it just helps to really understand the importance of making sure that you're vaccinated. And if you are vaccinated and get a COVID diagnosis, you are much more likely to have only mild to moderate symptoms than severe symptoms that might require a hospitalization. So a couple of weeks ago, we started looking at the map of Florida, and we were looking at new cases, and you'll remember that the brighter the state, the more cases that were being reported. This is perhaps a more helpful map because this looks at the counties in Florida, and the size of the circle is an indicator of how many new cases per 100,000 people have occurred in the last 7 days. And so this is actually pretty encouraging. You can see that there in Clearwater, Pinellas County, we have a pretty small circle. And so over the last 7 days, the data is beginning to show a little bit of a downward trend, at least if not for the state, then for Pinellas County. So we're going to come back and talk a little bit more, and I'll give you some more information about Pinellas County itself. So one of the interesting things that we noticed in this map, if you look at the major population centers, look at Tampa, Orlando, Miami-Dade County, where there is good health care, there is access and availability to medical care and pharmacies and clinics. It seems that either the medical care or the access to the vaccine seems to be better in the larger populations. And if you go up and look at the Panhandle, that's currently where this outbreak is occurring. And is that related to the size of the city and the lack of medical resources or clinical resources that might help you prevent or contain the spread of COVID? Okay, and so a little bit of good news here as well. These are the leading indicators, and it just looks at the situation week over week. And so you can see that week over week with new cases, we're trending about the same this week, where last week that number had been up significantly. So a little bit of a curve just in the fact that we are maintaining the status, it's not going up. Daily tests continue to go down week over week, so that we have a 2-week trend, and this is, again, per 100,000 people. It's a good leading indicator that a curve, we are approaching a curve and maybe getting a handle on being able to turn this spread around. The daily percent positive, this is the 7-day moving average. You can see last week, this week, it was about the same. And so again, a little bit of a trend, didn't go up, and maybe has hit an apex, and next week perhaps we will see a decline. Okay, so we'll now dig into the numbers here in Pinellas County a little bit and what's happening at Regency Oaks. And so over the course of the last 7 days, we have seen 109,503 cases here in Pinellas County. That's the cumulative total, and we've seen 1,671 deaths. Now, here's a important distinction. The number of deaths week over week, 7-day average, did not increase. So even though the number of new cases rose by almost 10,000 in Pinellas County, the number of deaths stayed exactly the same. So what that tells us is the positivity rate is high, the number of new cases continues to increase. We saw that on the chart, but we also saw that the number of deaths is not increasing. And so the majority of the individuals who are vaccinated are not ending up in the hospital, and the unvaccinated individuals who do end up in the hospital, although they are more susceptible to become a fatality if they are young and there is not an underlying medical condition, their chances of survival are about the same as someone who is vaccinated. The Delta variant, we know, is more contagious. It's nearly 1,000 times more contagious, scientists tell us, but it does not appear to be as deadly. And so we will continue to track those numbers. The positivity rate here in Pinellas County continues at 19%. And so we haven't seen much of a decline in the positivity rate. Again, if you count all the rapid tests that are being done across the county, whether it's at Regency Oaks or at local pharmacies and physician offices and retirement communities throughout the county, that positivity rate is probably much higher because the rapid tests are not included in the total. You'll remember that we used to look at the number of laboratory tests to determine the positivity rate. Now that rapid tests are more accessible to the communities, we're seeing an increase in the number of rapid tests and fewer of the PCR or curative lab tests that we're more familiar with. Here in Regency Oaks, the number of IL residents who are on quarantine, either with COVID diagnoses or individuals that we are tracking because of a potential exposure, has declined. Last week at this time, we had 23 residents, and today we're down to 15. So we've seen that number decline pretty significantly. Over in the skilled nursing, we have 12 people in our isolation wing that are under quarantine. Most of these are new residents who have just moved into the skilled nursing from acute care hospitals, and they go through a 14-day quarantine period. In terms of staff here in the IL, we still have our 2 IL staff members, and then over in the skilled nursing, there are 2 skilled staff members that are under quarantine. The actual number of residents and or staff that we are testing or suspect have symptoms of COVID are 0. There's nobody in our skilled nursing, assisted living, or independent living today that we are testing or suspecting of having symptoms of COVID. So that's a positive piece of news to report. Now let me just update you a little bit on these numbers. You'll recall last Thursday we had done some pretty extensive contact tracing, and as of Friday morning we had gone nearly 2 days without a new case. Now Friday afternoon, after our morning COVID meeting, late Friday afternoon, we had a couple of additional residents test positive in the IL. We had a resident couple and then a single household test positive. We've done the contact tracing, and we're trying to figure out the connections and where those dots will meet. Over the weekend, we had a really good weekend. There were no new cases on Saturday, Sunday, or this morning. So at the end of today, if all holds, we should be at about 3 days without a new test for positivity. And as you may recall, we're looking for 5 consecutive days without a new test in order to start lifting restrictions. So we think that we have the possibility of achieving that this week, and then being able to start having discussions about how we can get back to normalcy and removing of these restrictions. At this point, I want to talk a little bit about rapid test and testing. We think that we've identified everyone who potentially was exposed to one of the 4 events that triggered this spread. And we've done extensive testing. Maria has just been a trooper. Her and Leslie have done great work. We've tested as many as 40 people on any given day for the last week. And so extensive testing has given us confidence and peace of mind that we've reached a point where we no longer need to do routine testing just to provide peace of mind. So effective this morning, testing is available if you are symptomatic or if you are positive and have a spouse. We will be testing your spouse. But for just peace of mind, rapid testing, that is no longer going to be available. It's only going to be available if 1, we know there was an exposure, or 2, you are symptomatic. If a resident for peace of mind is looking to be tested, that service is still available. We can assist you in getting a PCR, a lab test, at Walgreens or CVS, our joint venture pharmacy partner. But because the number of cases have slowed, we've seen an improvement in the number of individuals who are quarantined. It's dropped by 9 residents. And the fact that we've gone 3 days without a new case, our protocol is changing. We no longer need to do the massive testing because the trend is showing that we're moving toward being able to release the community and eliminate the restrictions and get back to life as normal. So the other thing that happened this morning, just right before we came on air, is the FDA has announced that Pfizer has achieved full approval as a vaccine, and so it's no longer to be used or used only under an emergency provision. It is now clinically approved for full use without reservations in any age group for any purpose. So physicians will now be able to prescribe a vaccine. So with the FDA having decided that this drug is safe and having this massive clinical trial of 164 million people who have taken the vaccine, anyone is now able to go and get a COVID vaccine and without any prescription whatsoever. In terms of the booster, we are still waiting for the CDC to issue protocols and guidelines on when the booster shot is going to be available. We have, as I shared last week, we have already reached out to CVS and are working on trying to set up a clinic here at Regency Oaks for our residents' convenience. We have had a couple of residents share with us that they were able, because of underlying medical condition, to get the booster down at their local pharmacy, and so it is available. It may require a prescription at this point because it's not been approved for generalized use. So that's our update for today. We will continue to monitor the situation. I won't be back tomorrow, which is our usual Tuesday talk, but I will be back on Wednesday with an update. Again, our goal is to try to get through Tuesday, Wednesday without any new cases so that we can start thinking about how to reopen at the end of the week. Thanks very much for tuning in. I appreciate it.